Welcome to MindWise Podcast that embodies holistic perspective on mental health, spirituality, and wellness. I am your host, Dr. Ron Parks, a writer, teacher, and physician. Today, I'm sharing a tragic story that is a cautionary tale for ourselves, families, and community, and any provider of healthcare services. Tragedy to prevention. Lessons from the Reiner family and Americans' crisis of violence and complacency. The loss of the Reiners, a cautionary tale. The tragic and shocking newsing report, the recent knifing attack that resulted in the deaths of Rob Reiner and his wife, Michele, shocked the global community. Both were widely known and admired for their remarkable contribution to the entertainment industry, their generosity to various causes, activism for others' rights, and their advocacy for democratic organizations. Rob Reiner was especially beloved for his memorable acting roles in the classic creative films he directed. Despite their public successes, the Reiner family faced personal challenges, familiar to many families with disabled or emotionally struggling members, especially those dealing with substance use disorders and mental health issues. Despite the Reiner's family's achievement and the support of many friends and admirers in Hollywood, Rob's son faced ongoing struggles. He battled addictions, experienced repeated setbacks in drug rehabilitation programs, relapsed multiple times, endured a period of homelessness. Nick's parents made persistent efforts to help them through programs they believed would help and that they were advised would help. Nick's difficulty with addictions and possible mental health issues ultimately led to his incarceration as the prime suspect in his parents' murders. This story highlights the complex and sometimes tragic realities many families face when dealing with loved ones suffering from both addictions and mental health challenges. Without effective interventions, these situations can spiral towards overdose, suicide, or acts of violence. The Reiner case serves as a cautionary tale, encouraging us to look beyond the headlines and seek a deeper understanding and lessons that better support families and communities struggling with similar issues through prevention, optimized community services, medical and psychotherapeutic interventions, and better resource allocation. Recent news report revealed that Nick Reiner, now 32, underwent multiple drug treatment programs as a teenager. He reportedly suffered a heart attack on a plane using cocaine and frequently challenged his family with angry outbursts, periods of homelessness, and cycles of relapse. Addiction treatment often requires several attempts before recovery begins, and some individuals may never fully recover. Drug overdose is currently the leading cause of death for Americans aged 18 to 45, with fentanyl being a major contributor. Opioid treatment programs, OTPs, that use medications like methadone and buprenorphine combined with therapy have shown promise in reducing opioid-related deaths and overdose. Mental health disorders and substance abuse can sometimes lead to violent or deadly actions, especially when the individuals are under the influence, seeking drugs, or even when a change in treatment or psychiatric medications contributes to destabilization rather than improvement. Authorities have identified Nick Reiner as the prime suspects. Detail remains limited as the investigation continues, and not all evidence has been made public. The role of substance abuse, mental health, and treatment remains unclear, and prosecutors have not confirmed whether these factors were involved This case has garnered significant attention because of the notoriety of the family involved and because of the all too frequent deaths caused by a single disgruntled or compromised person. The larger concern in public interest centers on how to address the underlying issues to reduce and prevent these tragedies in the future. Of particular interest is a better understanding of the pattern of family conflicts and the precursors of violent or irrational behavior in vulnerable individuals, as well as the early interventions and prevention steps that might be possible. My previous articles have examined how addiction and mental health issues can be critical in the lead up to violent behavior. Influences such as social media, mental health struggles, interpersonal access to lethal weapons have been identified as significant. The recent tragedy underscored the urgent need to recognize and address these complex, interconnected factors to prevent future suffering and losses. Several other violent crimes occurred around the same time, including the shooting of students at Brown University and of a professor by the same former Brown student, a mass shooting, an anti-Semitic attack with multiple deaths at Bondi Beach, Australia, the shooting of political activist Charlie Kirk, and the murder of a healthcare executive, Brian Thompson, in Manhattan, allegedly motivated by the need for notoriety as an avenger against perceived grievances about leaders in the healthcare industry. These incidents underscore the importance of learning from such events and developing measures for the future. To understand seemingly senseless acts such as shooting or lethal attacks, it is crucial to recognize the complex interplay of factors such as mental illness, therapies and medication treatments, substance abuse, access to deadly weapons, media influence, and hostile rhetoric from public figures. These factors often overlap, contribute to violent behavior, as the person's accumulated pain, suffering, and loss of meaning or purpose, which can manifest as suicidal thoughts, distorted reasoning, delusions, or violent acting out. Several risk factors can increase the likelihood of violence, including rejection, low self-esteem, social isolation, and related poor social skills and difficulties at school or work. Experiencing or witnessing abuse, bullying, or domestic violence, especially physical or sexual abuse, further raise the risks. Marginalization and victimization can breed resentment and anger, sometimes prompting individuals to join extremist groups or adopt radical beliefs or intentions. Persistent grievance and a fixation on perceived injustices can fuel violent tendencies or lead people to support antisocial groups or become instruments of a hate group's extremist actions against others. Exposure to extremist political discourse, hate groups, or propaganda, particularly through social media, can radicalize vulnerable individuals. Violent video games, peer groups, and environments where violence is normalized or extreme. Additional risk factors include a lack of family or community support, isolation, and marginalization. When individuals accumulate feelings of being wrong or harbor obsessive grievance, they may direct their anger outward, especially if they feel victimized, underappreciated, or neglected. Isolation and exposure to misleading information online can further radicalize vulnerable individuals, sometimes leading them to seek notoriety, revenge, or justification for harmful actions. The risk of lethal outcome increases when access to deadly weapons, especially for those coping with internal pain from loss or depression. Socioeconomic disparities, poverty, lack of mental health resources, and discrimination also contribute significantly to violent crimes. What to know and pay attention to. People with mental health challenges, including substance use disorders, unstable moods, and certain personality disorders, are at higher risk of engaging in harmful behavior, especially if they have histories of trauma or abuse. The need to belong, particularly among those who feel isolated or have low self-esteem, does make individuals more susceptible to influence or to extreme ideologies. Individuals with poor social or emotional skills, often rooted in dysfunctional or abusive backgrounds, face increasing risks of physical aggression. Vulnerable people, such as those who are alienated, developmentally disadvantaged, are more easily influenced by propaganda and hate-driven message. Susceptible individuals may develop flexible or misguided beliefs, particularly if they experience delusions or paranoid thinking. Obsessional thinking, common in certain mental illnesses, limit adaptability and social understanding, increasing the likelihood of misinterpretation and aggression. As the mind intensifies, it impairs the ability to learn from social interactions and reliable information. While mental illness can lead to often unpredictable violent actions, legal standards for determining who possesses a danger to themselves or others may vary. This makes it difficult to intervene or commit someone to residential psychiatric and protective care when community services or the individual's family deem it necessary. Actions to consider and points to ponder. Support individuals or families facing mental health crisis by knowing local resources, recognizing warning signs of deterioration, and consulting with professional mental health providers, crisis services, or law enforcement as appropriate. Advocate for improved access to mental health services and public education to enhance the identification and support for at-risk individuals, aiming to prevent future tragedies. Promote responsible gun education, increase funding for mental health and substance use programs, more substantial support for law enforcement, and greater public awareness of warning signs of emotional and behavioral issues. Stay alert to misinformation, propaganda, or rhetoric that encourages hate and violence. Take proactive steps to foster reason and constructive community actions. Adopt personal and family strategies to support psychological, physical, and spiritual well-being, such as healthy lifestyle choices, spiritual growth, community involvement in supportive relationships, wellness activities, and seeking counseling when needed. For a complete article with references or inquiries, go to https://parksmd.com, and the library will post. I appreciate your interest. Please share with others. Thanks to Sean Parks, editor and project manager, for his valuable contribution editing. All content is created and published for educational purposes only. It should not be considered as a substitute for professional and medical services or guidance. Always consult a healthcare provider for care related to medical or mental health conditions. This communication does not provide medical diagnosis, recommendations, treatment, or endorsements. Thank you.